The second panel is entitled Building Community Immunity, Climate Adaptation in the Public Health Profession. And the moderator and also one of the panelists doing double duty is my colleague, Dr. Marc Shepard. Marc is Department Chair for Earth and Environmental Sciences and Associate Professor of Environmental Science and Technology. On the panel as well is Adelita Cantu, Associate Professor at UT Health San Antonio School of Nursing. She has over 35 years of public and population health nursing with a focus on primary and secondary health promotion and prevention of chronic diseases among underserved, vulnerable populations. Dr. Cantu is a member of the Alliance of Nurses for Healthy Environments and a mentor in their fellowship program. Recently, Dr. Cantu worked with the City of San Antonio in the development of their Climate Action and Adaptation Plan to ensure that equity would play a major role in the implementation of the plan. Marc Coudert, Environmental Conservation Program Manager with the City of Austin Office of Sustainability, is with us as well. As an employee of the City of Austin Office of Sustainability, Marc works with city departments to embed climate change resiliency into long-term operation and asset management planning. In this role, he also supports community organizers to increase climate resilience in East Austin. With us also is Mary McCarthy, licensed clinical psychologist in private practice serving children, adolescents, and their families. In addition to her full-time private practice, Mary serves as a volunteer with the American Red Cross's Disaster Mental Health Team, serving Central and South Texas. So now I'm going to turn it over to Marc Shepard.
Okay, that's what I thought. So Adelita, you want to go first?
I certainly will. I don't know how to do the slides.
Yes, so there's
Excellent. I'm supposed to be doing this job, so I'll.
Thank you. Okay, I think that's it. Thank you so much. Good afternoon, everyone. Thank you for allowing me to come and be a part of this. Saying hello from San Antonio. And let's see if I can get, okay. So I just wanted to, thank you for the introduction. I've San Antonio native, a public health nurse for over 40 years. I'm aging myself. In various realms, but in the last few years in San Antonio have been working very, very much with the Alliance of Nurses for Healthy Environments, which is a national organization, an alliance of nurses that are focused on advocacy, education, and practice when it comes to environmental health issues, particularly around climate change. And so, just as an introduction, in 2017, San Antonio, like as many other cities across the country, adopted the Paris Climate Agreement. And, excuse me, the city of San Antonio, in their plan, their commitments were for climate equity, carbon neutrality by 2050, climate adaptation strategies, and then certain reporting requirements for that. And this just at the very bottom of this gives a timeline of the city of San Antonio and meeting what they would like to meet. So here's a slide from the city of San Antonio that looks at greenhouse emissions from San Antonio. If we were to follow our climate action plan of carbon neutrality by 2050, it shows you what we should be doing on the graph. However, what we've been experiencing in San Antonio, which many nations across the country are experiencing, is that we've only decreased. This shows from 2016 to 2019, only 0.2%, and so we're very far removed or off track on our goals that we want to meet. And various reasons for that. We've had some reporting requirements that we wanted to put in place, like benchmarking, that have not happened yet. And there's a lot of pushback to doing that, to make that public information, as well as the city reformatting some of the goals that we wanted to meet. So this is just kind of a graphic on where we want to go and how far we are from that right now. So in terms of public health, and one of the things I'm interested in, we're all interested, but again, being in public health, is climate change and its impact on health. And I came in late this morning because the traffic was really bad. 35, in fact, was closed down this morning. So there may have been some talk about the health impacts. But again, that's just what I'm focused on when we look at climate projections. In San Antonio right now, if we continue on the path that we're on right now, where high emissions happening, we're looking at 10 plus days where we exceed the summer maximum temperature. Hot days where we'll be over 100 is 94 days. We're going to add 94 days to that. And the warm nights, and I always talk to my students about the warm nights and why that is so important. This is a time when the community, when the atmosphere as well as our communities should be cooling down. And again, if we continue with the projections we're at right now for high emissions, we're looking at 55 more nights where we'll actually be above 80 degrees. In San Antonio this past summer, and maybe here in Austin, we did have some nights where it did not go below 80 degrees. And then annual precipitation to a reduction of 4 inches. Increased flooding, increased extreme storms, all of those things that we've been talking about today will continue happening because of the global emissions. And our previous speaker talked about where we're at. I'm just going to focus on extreme heat, although there's many other impacts to climate change, disasters, and the not only the mental health issue, but there's a lot of physical issues that result from disasters as well as economic impact as well. But in just looking at extreme heat from a public health viewpoint, if we continue with our the emissions creating a warming atmosphere for us, in San Antonio there's a projection of having 170 excess morbidities. So that means basically in public health that if all things were equal, we could avoid 170 illnesses, diseases, as well as mortality, death, if we could just bring our emissions down. So to the health profession, this is a very, very significant issue in terms of making our communities resilient. And one of the ways that I'm focused on it, at least locally, and our previous speaker talked about being hyper-local, and locally at the Health Science Center is really understanding how we educate our health professionals to deal with some of these issues and health-related issues that are going to result from climate change. So I recently got a small grant to create an interprofessional course, which is medical students, nursing students, we have dental students, health professional students, called Health, Equity, and the Environment. So the idea was to discuss human health impacts on these disruptions, human-caused disruptions, highlight the unequal burden of these health impacts as well. So that's why we put equity in there. And I'm really, really appreciative of the previous speaker and his connection made to SES, inequality, inequity, and climate. So a lot of lectures. We had a lecture on air pollution, water pollution, disasters, and all from a health perspective so that we could better equip and give capacity to health professionals of the future to understand the connection between the two. But one of the things, and again, looking at community resilience, one of the things I wanted to do with this is a community service learning aspect. Having the students work together, going into a community to raise awareness about the issue of climate change, health impacts, and give something back to the community. So on May the 8th, we're actually doing a Beat the Heat community event. Some of the money that I was awarded is going to be used for fans. We're going to be giving fans away. This is in a very impoverished community in San Antonio, and San Antonio in the last few years has fluctuated between the first and second most impoverished city of all the 25 urban cities nationwide. So we certainly have the continued issue with poverty and inequality and inequity in San Antonio. So in terms of building community resilience, one of the things we're doing is this event where the students will actually be talking to community members about how to make themselves resilient to the extreme heat that we know is coming. But also, one of the things that we will continue doing is looking at the inequities, how those relate to the communities suffering some of these impacts, and how do we make them more resilient. So looking at many more of these community events, but my focus really is helping health professional students understand some of those impacts.
Thank you very much. That was very informative. If we could, just because I know you, many people want to ask maybe all the panel some questions, but while we have it fresh in your mind, is anybody got any questions for this particular speaker? Got one over there.
Hi, as someone who teaches nursing here at ACC,
Yeah.
I'm incredibly jealous of that new course. What suggestions do you have for those of us who have much more limited course hours to bring some of this information to our students?
Well, I think one of the things that helped me in terms of designing this was applying for that grant, an interprofessional grant, and getting that extra money that helped put that in. Going through the different structures in our health science center, that like the medical school has a different semester than a nursing school, and so it was a lot of working with the registrar's office to make the registration easier. But here in Austin, I know that this is where the Texas chapter of the Physicians for Social Responsibility is. Dell Medical School does have an elective course for their medical school, and I do have a contact with their executive director. And afterwards, I'll give you my card so that I can get you in touch with her, and she may be also able to help you being able to instill that course here as well. Thank you.
One more. We'll take just one more, and then we'll move on.
Given that socioeconomic inequality includes a preponderance of treeless neighborhoods and poorer communities, I'm wondering to what extent San Antonio is working on improving that situation, given its strong correlation with better health outcomes, better mental health, lower crime rates. I know that Philadelphia is pretty active in that direction.
Thank you for that question, and that's one of the things that I really, really am very appreciative of the city of San Antonio is trees. I mean, there have been so many tree giveaways in lower income communities, so there is an effort to increase the number of tree canopies in the area, particularly around bus stops. But also, one of the policies that the city of San Antonio has adopted through their Parks and Rec is a commitment to have everyone live within a 10-minute walk of a green space. And so they're not there yet by any means, Parks and Recs, but certainly that is a goal. And again, our previous speaker talking about that hyper vision or hyper attention to local communities, that is one of the goals they're trying to get there. So a lot of effort has been looking at green space and how to utilize space that we never thought was green space and turning that into. So like if there were vacant homes, there have been now some of those homes demolished, and that space has been used for green space now. So great question, thank you.
Okay, yeah, we can take one more if there's anyone. Otherwise, we can. Okay, so thank you, Dr. Cantu. I appreciate that. Let's move to Marc. Marc is going to give his presentation, and hopefully it'll get loaded here in a second.
Hey, good afternoon. My name is Marc Coudert, and for the past 13 years, I've been with the Office of Sustainability, but I'm actually on loan right now to the Office of Resilience. About 10 months ago, the city hired on a chief resilience officer with no staff and no budget, so I'm on loan to her, and we were able to get some funding through UT and some other folks to get a couple people on temporarily. So we are trying to get this moving quickly. But there's definitely a sense of urgency and agency throughout this process. So I'll talk a little bit about what I've been working on and then how things have changed in the last 2 years. As we've talked about earlier with Dr. Kirkman, but also in this whole discussion today, is that we've had extreme weather in central Texas or in this area for a long, long time. We've had mega droughts, we've had droughts, we've had rainstorms. We live in a fire adaptive ecosystem. The thing is, though, is that our population is booming, the demographics are changing, and the climate is changing all at the same time. And we're trying to see, how does this all relate? So we've had heat waves. In 2011, we had 90 days over 100 degrees. People often forget in February of 2011, it snowed. And the city shut down for a half inch of snow. We've had the 2013 Halloween flood, the 2015 Halloween flood, we had the Memorial Day flood, and then we had Winter Storm Uri, that's the one in 2011. We had Winter Storm Mara, which is the one, what feels like 2 months ago? 2 months ago? Yeah. We've had these events, and they're happening more often and impacting more people. So in my work with the Office of Sustainability, it was working with assets and operations managers around how will climate change impact both our physical infrastructure, but also staff working in the field. This is very much an engineering process. You ask the question of what is your most critical assets? And then of those, which ones are exposed to heat, drought, flood, wildfire? And then if they're exposed to heat, drought, flood, wildfire, are they sensitive to those? And if they're sensitive, what's the adaptive capacity? And you get down to 20 assets, and you put together some strategies that the utilities were like, this is very nice, we'll do it someday when it becomes serious. And we go through this process, and for the most part, departments were on board, but this is before the winter storm, so their sense of urgency wasn't really there. They're like, well, we'll get around to it, these things are important, thank you very much. But on the other side, I was feeling really confident. I had gone through working with 20 departments, 100 people, I was like, I'm an expert. And then somebody asked me the question, it was like, how does this impact the community? And I, being all full of confidence, went to the community and said, let's talk about resilience. And Francis Acuna, which was here this morning, was like, you seem like a really nice person. Why are you coming to us talking about resilience? We've lived through these floods. We've bounced back. We've had to deal with this on a daily basis. What do you know about our lives? And we were like, well, yeah, we got to stop. We just got to we got to slow down, see what's going on. And we started this process of talking to community members about what's going on in their communities when it comes to climate change. And the conversation shifted from, hey, all these big storms or whatever, to there are daily stressors. So now when we talk about climate change, it's about shocks, it's about stressors. It's about day-to-day living and seeing how you can adapt to these events. And what we quickly realized is that there's no silver bullet. There's no hey, if we do this one thing, everything will be solved. We can't talk about any one of these issues without talking about the corresponding issues. You can't talk about drought, air quality without talking about elderly, criminal justice. You can't talk about flooding without talking about mobility, mental health, food security. It's all of it. We have to raise all boats in order to make this right. And we can't just fix it with one thing. But what does that mean? That means talking, that means figuring it out, that means connecting data to stories and connecting stories to data, right? Because we can't make the right decisions without understanding what people are going through. So feeling a little bit dissuaded, we're like, where do we even start, right? You get into this point where like, we're doing all these bad things, creating all these issues, all these unintended consequences. Where do we start? So we started with asking the question, what control do we have in the community? And we came up with this, like, you know what? The city owns a lot of land. Watershed Protection was here this morning. I think Kevin Chunk was here. Watershed controls a lot of the land in the creeks. We have Austin Energy owns land, Austin Water owns land, Parks owns parks. We have a good connection with schools. A lot of these departments, public health has health centers, we have rec centers, we have libraries, we have convention centers. Roads and bridges are mostly in Austin controlled by us, although some are controlled by Travis County and state. We have a lot of capacity. We just need to figure out how to tie management of land, management of services with what the community actually needs. We make a lot of decisions based on assumptions. We don't make enough decisions based on community needs. So I'll run through a couple of these. We are also working with heat. We talk a lot with Murray Myers at the San Antonio Office of Sustainability. I know Doug from way back when. Yeah. So we talk to a lot of other cities about how they do it. We're doing pilots around cool pavements, but we're also having conversations with Go Austin Vamos Austin, which is the community organizers, and community members in Runberg. Somebody mentioned trees. Our lowest tree canopy is in Runberg. If you look at the whole city, Runberg has like 10% tree canopy. West Austin has 40% tree canopy, which is a huge difference, right? And if you look at impervious cover, so parking lots and hard spaces, most of it is in Runberg. A lot of it's at the airport. So, like, how does that correlate into lived experience? We've been talking to community members about what they need. We came in thinking they want trees. They do want trees. But they also start talking about, hey, my spouse is coming home from working outside all day with headaches, nausea. They're not engaged with my kids. My kids don't want to go outside because it's too hot. Like, what is the mental health impacts? You said temperatures below 80 degrees at night. Standard, if people don't get below 80 degrees at night, they don't function. You don't sleep well. You can get in trouble. The next day, your body's not prepared for heat. Heat kills more people than any other natural disaster. So we're looking at, pathways, parking lots, crosswalks. Where do we put bus shelters for bus stops and other projects? And then the other thing we started talking about is wildfires. We have huge wildfires in Austin, but they typically happen once every 10 years. Who was ever here in 2011 remembers the Steiner Ranch fires, the Bastrop fires. They make a lot of news, a lot of mansions go up in flames. You can see big planes coming through, and the governor shows up with his badges and he's doing his work. But we don't talk about grass fires. Grass fires happen every single day. They're only, flames are about 2 feet tall. They travel about a mile per hour. They hit a road, they go out. But we mapped asthma rates in Austin, which is almost all on the east side, and grass fires, which is also all on the east side. I'm not saying they're connected, but they impact each other. So we're trying to figure out, how do we manage land so that we don't have grass fires in areas where people are impacted by them. Flooding, I know Francis probably talked about flooding this morning. And then Kevin Chunk with Watershed also talked about flooding. It's a big deal, specifically in the Southeast. Think about the whole state of Texas is 2% slope towards the Gulf. All the water drains from Northwest Texas to the Gulf. So if you think of Austin, a lot of that water drains to the Southeast where low-income populations live. So how do we manage our land use so that we don't increase that flooding in that area? Another piece, and if you look right here, most of these communities have one way in, one way out. Most people who die in a flood die in their cars. Most people who die in wildfire die in their cars, trying to get in and out. So how do we start to look at neighborhoods to see how do people get in and out, and then ensuring that when they get out, they go to a refuge area, a place that's safe, right? So that's another discussion. We're doing this mostly in West Travis County, but looking also for flooding in East Austin. And then lastly, resilience hubs. Resilience hubs gets a lot of press. People think it's awesome. It sounds awesome, right? Oh, I want a resilience hub. It's going to cure everything. It's going to cure cancer. It's going to, solve all these problems. But at the end of the day, resilience hubs are trusted, community-focused locations where people go to on a natural basis, would go to on a daily basis to help people before, during, and after an event. Oftentimes, people say that they want resilience hubs to be shelters, they want a ribbon cutting, they want politicians want to show up and say, look, we have a resilience hub. But when in fact, it doesn't have to be a shelter. It could just be a home, it could be a library, it could be a church, it could be a rec center. It has to be a place that people feel safe and that they can help each other. And lastly, I don't want a situation where people go to shelters. I would much rather help them at home and make sure they can stay home during an event than having to go to a shelter. So if these locations could help people stay at home, I'd be very happy. And then lastly, this is my last point. I've been talking about negative things, right? Deficit-based thinking. We have heat waves, we have floods, we have all these bad things. But what I didn't talk about, there are a lot of wonderful things happening in the community. There is, like Francis said, a natural resilience within these communities. How do we bolster that? How do we empower that to happen rather than just always be thinking about how can we save them or how can we, fix things from our perspective? How do we lift up the people to ensure that we're listening to them and making the right decision?
Marc, are there any questions from anybody who'd like to ask him a question? There's one over in the end. There's a couple.
Hi, Marc.
Hi, Jonathan.
I've had this question about resilience hubs for a long time, and I've never asked it, so I'm going to do it now. When you think of a hub, is it possible to not only think of people going to them, but supplies going from them to homes as a way to help stay at home, like whether it be batteries or food or whatever is needed? Is that part of the model and part of the conversations?
Yes and no. We are talking to Cap Metro about their electric fleet and their ability to have their electric buses show up to communities to provide power during events. We saw this during the pandemic where school buses went out with Wi-Fi, and computers. And I think that's a way to get things to the people. We are talking about how do you store food and store water at locations. We haven't talked about how to get that to the houses per se. But I do have one more thing is we've been calling it a resilience hub network, right? Because no one location will be able to do everything. You can't have a situation where you have sheltering and food distribution at the same place because it's too much confusion. So we're talking to the schools, we're talking to community health, the health centers, the libraries, all these locations in the community that can help each other so that we can sort of connect them all into a sort of a hub and spoke model. And lastly, I just noticed this. This is Celine Randon took this picture, who spoke this morning.
Just to add one thing to that as well in terms of resilience, our public utility, CPS Energy, has been providing funding for households that are qualified. They come in and weatherize their homes, so seal up the windows, doors, things that might need to be repaired to make the house more resilient as well. And that's through our public utility company. And I don't know if you're doing something similar here in Austin yet.
Yes, Austin Energy does have weatherization programs. Yes.
I'm wondering, there's a natural tendency to focus on homeowners, renters, people with housing, and I'm interested in the most vulnerable population, those who are unhoused, and how that's going at this point with Austin, maybe in San Antonio as well.
It comes up a lot. It comes up a lot during major events when we have to open up shelters and separating, single men of women, of people who are unhoused, people with housing, and then there's always tension between local community versus unhoused communities. I mean, you can't avoid it. It has to be part of the conversation.
In San Antonio, we have an innovative model, Haven for Hope. It's a huge campus, and it looks at the unsheltered in two different ways: people that are chronically unsheltered, as well as people who want to transition out of homelessness. San Antonio just has made an investment to 3 nonprofits that are focused on the population that's chronically homeless, and is going to build housing for this population, and looking at it from the housing first perspective, giving them shelter, and then providing services if needed after that, but trying to get them as much as possible inside an area where they can become more resilient to extreme weather events.
Hey, I was going to ask you this morning, both Celine and Francis, they spoke a lot. Well, this is in recognition of something you said. You were talking about all these deficits and these challenges, and then wanting to celebrate the strength of certain communities in Austin who have weathered the brunt of these challenges. Hearing from Celine and Francis this morning, there was a lot of talk about how we're at jeopardy of losing this community from gentrification and development policies and zoning projects that, you know, prioritize so-called affordable housing, but the MFI requirements are just drastically out of touch with like what the actual low-income populations in these areas are capable of earning, and then therefore moving into these spaces that are supposedly being built for them. Can you speak to how your office is trying to respond to those allegations and those challenges facing those communities?
Is that for you? Oh boy, it's really hard. The issue we're coming into, and there's so many issues. I mean, there's like I showed that graphic of all these things are interconnected. I can't just solve. I can't solve myself, but we can't just solve affordable housing and assume that's going to fix everything, right? That's one thing. The other thing is, you know, we run into this issue of we're talking about heat with community members in Runberg, and this question about market rate affordable housing shows up, right? Is that these are low-income units, not because they're destined to be low-income units by the federal government, but it's because they're in bad shape. And the community's like, don't ask my owner to do too much or else they're going to raise the rent, right? And then they'll get kicked out. But if we do nothing, I can't sleep at night if I think that we do nothing to keep things horrible in order for it to keep it cheap. So then you get into the situation where, like, do you invest in the low-income communities? And I say, yes, you have to. But you have to do it with the community input, right? The community has to tell us and inform us, like, how do they want to grow? I would love to say that I can fix this, but we grow at 130 people a day. Just in the time I started talking, like 6 U-Hauls just showed up. And we can't build 160 units of affordable housing a day to keep up with that when we're already in a deficit of housing. At the same time, if we do nothing, is that going to fix it? Like, it's a really long way of saying I can't answer.
I totally agree. I think it's just such a complex issue. And I go back to our previous speaker. I think he's still here. And it is those structural inequality and inequity issues that really need the conversation, because those then will have input on affordable housing, economic prosperity, et cetera. But it's those structural issues that need so much attention. No silver answer to that, unless you've got anything.
Well,
Okay.
Well, that's probably a good segue. Why don't we move into Dr. McCarthy, who's going to talk to us about mental health.
there. Okay. doing presentations like this is a bit out of my comfort zone. I tend to work one-on-one, not only in my professional practice as a psychologist, but also with disaster mental health. And I work with the disaster teams, so it's teams that go into situations where communities have experienced disasters, and I'll go into that in more depth in a moment. But we're part of what's called boots on the ground, and I joined doing disaster work during Hurricane Katrina, although I wasn't with the Red Cross, and learned very, very quickly, as we had, since I was part of the first responders, how to meet individuals one-on-one as the planes landed in Austin, Texas. And from there, I went on to, during Hurricane Harvey, became part of the disaster mental health teams with the Red Cross. And one of the things that I have learned in being with the Red Cross is the depth of knowledge they have in coming together, in integrating services, and really staying focused on the individual, which personally is very important to me. Disasters that I've worked have included not only hurricanes, but the floods in the Hill Country. I was also part of the first responders down in Uvalde, because we do disaster casualties as well as a regular member of the disaster teams that reaches out to individual house fires, of which there are many, and also serve in trainings for the armed forces, doing work with individual people who are serving within the armed forces to alleviate trauma, and to not only the service members themselves, but to their families. So the mission of the Red Cross, and I want to pause here for a moment, because personally for myself, but also every Red Cross person I've worked with is very dedicated to alleviating suffering, and it's suffering of the individual. And so in this way, and I know that the other speakers today have talked about this, we are responding to the extremes in weather that are the result of climate change, and there is suffering that is occurring. And so what our teams go in as a compassionate presence. We're not going to fix, but we can come alongside, and we can be with the people to move through the disaster and into resilience. And so in that way, we're holding and also executing an interconnectedness among people. One of your questions a moment ago, I think, speaks to it sounds simplistic in some ways, but it is not. And in my opinion, and in the work I've done with the Red Cross, it's the interconnectedness among people coming together, walking alongside each other, that builds resilience within communities. So in responding to disasters, much has been learned that informs our adaptation skills. And this is bringing those human connections that I mentioned, but also how together can we stand knowing that we have an uncertain future. And so in that way, and I have learned this personally, in going into disaster situations, I am not going to know everything. There is much I do know in my training as a psychologist and providing support for mental health and people who experience trauma. I may have a background, but I need to walk into any situation with an element of not knowing, so that I have space for the individual and the situation to teach me. And in that way, I'm bearing witness to the moment and moment-to-moment tracking, so that there is an adaptable response. And that from those two places of not knowing and bearing witness is when right action, a way to move forward, arises. And I want to also mention that volunteers within the Red Cross make up 90% of the workforce. So this is an organization that is dominated by volunteers. So in this past year, we have, the Red Cross has responded to over 74,000 disasters. This has gone up exponentially. And even as we're sitting here today, I am aware of the floods in Florida. We've got Red Cross on the way there. We're responding to the disasters that are occurring because the lakes are filling in California due to snow melt. We've got the tornadoes that have just ripped through. We have 2 mass casualties that occurred. And so what is happening is that even though Red Cross has great capacity and responds to every disaster, we're really being stretched. Part of when I was talking to one of my colleagues in the Red Cross, she was saying, we used to talk about seasons, like the hurricane season coming through, or the fire season in California. What is occurring now due to climate change is that there aren't seasons, they're overlapping. And so it is demanding even more. So after a disaster, the types of things that we provide are, we do provide shelters, but also individuals. Like when I was working in the floods in the Hill Country, we went in vans to individual homes and working with them, over what their needs were, also bringing in shovels and, bleach and all just basic needs, as well as food. And one of the things that I was surprised by, especially working in the Hill Country, I got into the community that was right along Lake LBJ. They had opened up the floodgates, so that community got flooded. And there was a woman who just was distraught, and she came running up and she said, I can't get my husband down from the 2nd floor. It turned out he was not ambulatory, and so then his elevator that was in the home wasn't working, so he was caught on the 2nd floor. So we went in with a team and were able to bring him down. That's what I'm talking about when I refer to boots on the ground. It's an individual person-to-person connection that occurs. So in responding to disasters that the climate, chaos has invited us to revisit these values and these intentions, that as humans, we are part of the problem, but we're also part of the solution. And so we need to strengthen the connections between each other and in our communities and with our earth. Now, the Red Cross provides, what I'm part of with disaster mental health, is providing psychological first aid. And we are trained to recognize and respond to the immediate psychological supports that are needed and emotional supports that are needed to alleviate trauma. But it is not therapy. And I've become very, very clear on the difference between providing psychological first aid and doing therapy. The main thing that when we go in, we're looking at what we call the 3 R's. What are the reactions of the individual, to the situation that they're in? And then looking at the risk factors that are around that individual or the family that we can help support and alleviate. And then looking for resilience. And what I am really struck with, human resilience is strong and it is present, but we need to be focusing on it and aware of it. These are some of the types of disasters that we respond to. In January of 2023, there were over 5,200 home fires alone. And that's part of the team that that I'm on, that we go to the home fires and help with people. I don't know what that, oh, there it is. Okay, so these are the different areas that the Red Cross does serve. We do trainings, both CPR. We also disseminate smoke and fire alarms to homes, and in a very direct way that isn't immediate disasters. There is the International Red Cross, but I'm speaking predominantly today about the American Red Cross. The services to the armed forces, I believe I've mentioned, and also blood drives and collecting blood, and the American Red Cross is part of that. I'm representing mainly the Central and South Texas region, and if you'll notice, the region that we serve, this team, is vast. It's a tremendous amount of distance, locality-wise, but also the disasters are increasing exponentially. So I need to hit it twice. There we are. Okay, so in training, we train more than 4.6 million people in serving in disasters. So that is also something I think that's really a value, is that the Red Cross has a knowledge that goes over decades of how to train people to go in and serve on an individual level. These are the primary, and I'm speaking again with disaster mental health, although there's disaster health services, there's also, where we go in with, again, construction people and to help on a very pragmatic level. But with disaster mental health, we're supporting the emotional health of the individuals, the families, the communities, and also other workers. I have worked, when I work in communities, in a very disciplined way, but across organizational ways. So what I would like to end with is to also invite all of us to consider what our spheres of influence are, where our points of connection are, and how we can start to build within our communities as we address these crises and the chaos that's being due to climate change, and also where we can take action. The speaker that spoke to us this afternoon started out by saying no one is an island, and we truly know that humans have the capacity to transform our attitudes and our behaviors. And so with what is occurring today in getting together and talking about these issues, but also individual person to person, that in my opinion, and also from what the speakers were saying earlier, that's where our hope is. Thank you.
McCarthy, are there any questions for Dr. McCarthy?
I have a question,
Okay.
actually.
Oh, we have one over there.
Okay, I'll take yours first.
Thank you for your presentation. I was just curious. You said that there's a significant difference between disaster relief and ongoing therapy. Do you help folks to make any kind of transition that would allow them to kind of set up that ongoing therapy? Because I heard earlier today from Ms. Acuna that there's a lot of need for ongoing therapy with the reenactment of trauma every time something happens in that area, or every time she's required or asked to share a story. it just kind of triggers the trauma that has been experienced. And I don't know, you're kind of at the moment in the midst of whatever is going on, but I guess more of a long-term kind of assistance. Are there efforts in that area?
Thank you. Thank you for your question. Yes, that is actually part of what when I go in disaster mental health and I'm working one-on-one with a person, I am tracking what the risks are for that person. And if it is that they're needing additional support, I'm going to make sure that the individual I'm working with transitions to a longer-term mental health support. And I say that and also am critically aware of how difficult that is, because we do have a tremendous need for not only accessible mental health services, but ones that are not so costly. And so it is and the Red Cross has, a pledge that I never leave a person or close a case, if you will, until I can transition that person into more active, ongoing support. So, and that's true of shelters too, on a very pragmatic level. We never close a shelter when there are people still in there that are needing a transition. And I know that when I was working Hurricane Harvey, we had a number of homeless individuals who are in our shelters, and it was a lot of work to find ways to place these people in more permanent housing before we close the shelters. So that's where there is an integration, if you will, between disaster work and ongoing work. When I'm going in, I'm assessing the risks, I'm providing an immediate compassionate presence, but ongoing work with therapy is good, or with the traumatic response is going to integrate with the past of that particular individual, and that's the work of therapy. So that's not something I can offer as a person with the Red Cross on a long-term basis, but what I can do is help them transition to other agencies that can.
Any other questions?
Yes, I have a question. So all of you have talked about natural disasters and the responses to those natural disasters. And we all know that the most vulnerable people in those natural disasters are people with some sort of disability, physical, emotional, or cognitive disability. And they're the ones who suffer disproportionately from those disasters. What kind of procedures do you have in place in the city with the Red Cross, whether it's San Antonio or Austin, to help people with disabilities?
So in San Antonio, we do have a nonprofit, BCFS, that is tasked with the issue of medical shelters. So this is an agency, a nonprofit, similar to the Red Cross, but setting up a shelter, but their focus is on people who have experienced a disaster and have some chronic issues, chronic disease issues. They're on medication, they're disabled, they need to have a service animal with them, psychological, psychiatric issues. So their focus is developing or putting up those medical shelters when disasters do occur.
And along with that, with the what I'm aware of with the Red Cross is the people who are volunteering, many of them are highly trained. Like prior to going into doing my own private practice, I was with the University of Texas Center for Disability Studies for 13 years. So I have a very strong training in working with people with disabilities and a wide range of disabilities, as well as I sign. So, and those are, so we can draw on that. But, the Red Cross is also, and as a member of the Red Cross, I'm aware that we need to integrate with the communities and what community services are there. So one of the best things is the wider my knowledge is of what is available in that local community and who are the contacts, and then we bridge in that way as well.
Yeah, so similar to San Antonio, we also have programs within each department that sort of discusses disabilities. For example, in Austin Energy, we do have specific locations that don't lose power because people are on ventilators, and we do have health services within our health clinics around Austin, which are sometimes tied to our rec centers, and they provide different services. But I think there's sort of another question there of how do we connect with those people? And one thing we're talking about tied to the resilience hubs is how do we pay block leaders, or what Francis would call community climate navigators, to go down the street and understand who's there, get their input during the daytime, but then when an event happens, they can be like, hey, Miss Johnson's down the street, she's in a wheelchair, we gotta go and check in on her, so that we're always checking in. I think one thing that's important to know is that a first responder during an event is not going to be the police department, it's not going to be EMS, it's not going to be the fire department, it's going to be your neighbor. So how do we build that community cohesion so that we're checking in on each other and know who's where, so that when an event does happen, it's not guesswork, right? So it's a combination of what the city can provide, but it's also what the community can sort of talk to each other about to make sure people are safe.
Any other questions? I do have one. I know you guys have talked a lot about communities. Is there one, I guess, are you interacting with homeowners unions or homeowners associations, and how does that work? Or does that not really fit into the model? And then what trends are you also noticing, maybe as you're doing disaster relief? Are you noticing that there are any trends? Are the disasters not only getting more numerous, are they becoming more complex? Something, if you could, I know it's a big question, but if you could.
Well, I can speak to the complexity. They're becoming much more complex. Just in a very, physical example, let's take Hurricane Harvey. I know that the previous speaker put up that slide about the hurricanes increasing in intensity, but not necessarily in number. Well, Hurricane Harvey came in 3 times. It came in at Corpus Christi, bounced back into the Gulf, came back in at Rockport, bounced back into the Gulf, and then hit Houston. And so that was a hurricane experience like we had never had before. And it is getting more intense. Yeah.
I can also talk about Hurricane Harvey. So at the Health Science Center School of Nursing, one of the things we were asked to do is go to Rockport to provide some services. We have a mobile unit. So faculty and nursing students went to Rockport. And it was amazing to me. I don't think I saw a roof that did not have a tarp over it. It was the extent of the disaster. As I was coming into Rockport, all of the telephone poles, just like matchsticks, all broken. But the thing that was really, in terms of complexity, is that it really devastated their healthcare infrastructure in Rockport. And so we had people coming to us that were abrasions, cuts, they were walking the water, abrasions. So we were giving hepatitis A vaccines because of the risk factors there. But they didn't have their medication. They didn't have access to that. So not only was the disaster itself, the physical disaster, bad, but then all of the downstream effects with that healthcare structure. So there were many people that were without their medication, without their treatments, and then we also understood from a lot of parents telling us that their children were suffering post-traumatic. So that when just rain came or a thunder, they hid under the table, they were screaming, or they would not come out of the room. So there was a lot of mental health impact. So physical disaster, yes, but then all of those downstreams, I think, is adding to the complexity of it.
Okay. The one other thing, the first part of your question, I have been struck repeatedly that in a disaster situation, how incredibly communities come together, and the faith-based communities come together, and we are all become humans. You know, what used to separate us in ideology or SES or any of those sorts of things melt away in the face of a disaster. So if there was a way for us to begin to learn from that, the strength of that synergy that occurs when we all come together as a human family and take that forward, I think that's what's going to really respond most effectively to the climate chaos.
I'm seeing two trends right now. One is the political ramifications of climate change. Nationally, we're seeing the political shift. Even locally, our city manager was let go. Like, these are having political ramifications, and because people are asking, like, what's going on. The second thing is that people are starting to rise up. And although, you know, storms don't discriminate, recovery does. And I think what's happening is that after an event, people show up, but you know what else melts away? The city. So, like, what is the role of the city in recovery in short term, but what's the role of the city in long-term recovery? Because, as Francis would say, we depend too much on churches and themselves to get back up on their feet. And that's not resilience. I mean, if you bounce back to where you were before and you're poor, that's not resilience. We got to bounce back better, not only as an individuals, but as a community.
Any other questions? Yeah. All right. Thank you, panel. I guess I get to do double duty with the last presentation. Dr. Ivan Castro was going to give this presentation. I've worked with him, though, so I can do it for him. In fact, I was one of his graduate students, and we worked on emerging infectious diseases and wildlife. Since the pandemic, I think most people now have become much more aware of epidemics and pandemics and sometimes what that means and what it doesn't mean. How did you guys change it? Oh, there we go. There we go. So why do we care? A couple things that come to mind. An estimated 75% of all the new infectious diseases are zoonotic, meaning that they are transmitted from humans to animals or animals to humans or vice versa, lots of spillover effects, and that's going to be significant. If you look at it today, well over 60 to 70% of our diseases that are currently, not just the new ones, but the ones that we've had for long periods of time, chronic diseases that are in the community that are infectious, well over 60% of those are shared between wildlife and humans. So that's significant. And so if that changes as a result of climate change, that has some really big implications. Melting of ice and permafrost could lead to a reemergence of ancient diseases. We've seen this actually happen, and we'll actually talk about a case. So that's something that we've not had to deal with ever. Is melting ice and ancient diseases that are being re-released into the world. Another one is global warming could cause viral mutations that resist our defenses for fighting illnesses. We're already seeing that. And then the last one I have here is just one of many, or four of many rather. Infectious diseases are not typically recognized as the cause of species population declines. And it's actually kind of interesting. One of the things that COVID has brought forth, we were starting to recognize it early after West Nile virus, but is that a lot of the species that we think are going extinct for different reasons may be actually succumbing to population declines because of diseases. So that wasn't something that was typically recognized before in wildlife. We typically looked at diseases and said they were compensatory, which means that they usually weren't something that was going to cause the population to disappear. They just might cause reductions in the population, but now we're recognizing that it has the strong potential to make populations completely go extinct. So some key points as I go through here, not all of them are wordy, so Climate change could affect vector-borne diseases. This is one of the easy estimates, right? Because most of our vector-borne diseases are mosquitoes. So more water, more heat, more mosquitoes. That's not too hard to predict. Climate change effects are recognized as having several mechanisms. There's some are really surprising. So there's a lot of things that aren't really well understood about how climate change is causing diseases to spread. Impacts will vary from region to region. I think our panel up here has made that clear as we have disasters, responding locally and understanding how to respond to local. And I'll give you a great example of this. In the United States, when COVID first came out, or was emerging, I actually was coming back from Peru. And so I didn't know it was coming. It was in January of 2020. I just got back, and everybody was going through the whole COVID thing. And they said, well, where have you been, Marc? In a rainforest? And I said, yeah, that's where I was. So I really didn't know what was going on until later. But one of the things that was kind of interesting about responding locally to climate change effects is that in the United States, when we have lots of, there's many HEBs, many different grocery stores that we can go to. In Madagascar and in Peru, there are a lot of open markets there's only one market for everybody to go to. And so infection control is a lot different when everybody's going to the same location and they're obliged to, as opposed to when we have lots of different locations they can go to. So it is important to understand how the population works, and I'm sure that's probably something that Red Cross is very familiar with in some of these cities too. Current evidence suggests that some climate impacts are maybe already occurring, and then the impacts may include emerging infectious diseases, things that we've never seen, didn't even know existed. So let me do a little background. What's a vector-borne disease? It's a disease that's spread by arthropods, or basically insects, most of the cases, not always, or small vectors, animal vectors. They act as the main mode of transmission of infection from one host to another, and as such form an essential stage in the transmission cycle. That's a big way of saying that they form these connections between populations of different species, or of the same species, but certainly of different species, and have the ability to transmit different types of diseases. Here's what you typically see, when you're talking about transmission. You see a lot of human-to-human infections, so there are a lot of those: malaria, dengue, yellow fever. Most of these hadn't been seen in Texas. Yellow fever still, I don't think is here, but malaria is not really here, but dengue has made it to Texas, and so we are seeing some cases of human-to-human transition of that. And when I say what they call anthropogenic infections, those are, if you get that disease, dengue, then there was somebody who also was infected, and there was an insect vector that brought it to you. That's a little bit different than the animal vector human diseases, where you see, it's off, but Lyme disease, hantavirus, and some of the arboreal diseases. Those are typically animal to animal, and we are not usually the ones that are targets. We are a dead-end host, and so when we get it, the disease has all kinds of effects that you don't see. So there's lots of animal populations that aren't affected by malaria or any of these diseases, but once it gets into us as a host, the disease has all kinds of, most of the time it's deleterious or negative effects. They don't usually have good effects. So last one, I have a triangle on here because a triangle explains everything in science. So you have a vector-borne disease, you have a susceptible population, you have pathogens, and you have vectors. All of these have to come together in some way for you to have an outbreak or an epidemic. And so what you notice, though, is that even the triangle doesn't really explain everything, because there's lots of other things that go underneath there. How long does the vector survive well? Does it not survive well at the temperatures? And as temperatures goes up, how does the vector change? How does the pathogen change? So here's some, what evidence, one of the things I want to start off is, what evidence is there now that we are having climate effects that are affecting disease incidence? I'll give you a couple of them. Between 2004 and 2018, the number of reported illnesses from mosquito, tick, and flea bites more than doubled in the United States to 750,000 reported cases. That's significant. If you look at that, that's a very small period of time for a doubling of infectious diseases that we had not seen. Some of that is transportation related, as we have more and more people who are traveling from different places. More and more what we used to call exotic diseases are showing up. And so, but that still wouldn't explain the number of cases that doing more than doubling. 9 new germs spread by mosquitoes. Ticks were discovered or introduced into the United States during this period. So we've got 9 new specific diseases that are infectious that we had never seen before. The geographic ranges where ticks spread, Lyme disease, and all these other types of spotted ricketts, and all these other types of diseases that we have are predicted to worsen. So these all come from the CDC. So that's they have some very good, better explanations probably if you want to research that. Oh, I'm sorry. Oh, what's the picture? Those are sandflies. Sandflies. It's kind of interesting. They're very weird because they're individuals. They don't want to get lost. They're much easier for other predators to pick off. So they travel as a group, each one taking its turn being at the front and the back. So sandflies. So they are responsible for leishmania. They spread that. So, but they are kind of interesting. A couple other ones. In 2012, a mild winter, an early spring, and hot summer set the stage for the outbreak of West Nile. We had 5,600 cases, 286 deaths. Warming temperatures in Alaska have led to an increase in vole populations, which carry Alaska pox, which is it's related to chicken pox and cow pox. And so that is going on. Alaska's got its own pox now. And then we have valley fever, which is caused by a fungus. Not too many fungus that infect humans. So that's already spreading also. And so there's some concern about whether, if fungus can take hold in populations, that's a really bad day because those are very hard to treat. Pardon me? Last of Us? Yes, The Last of Us. Everybody asks me about Last of Us. Last couple, some that were very odd. I'll just mention 2. In 2016, a 12-year-old child died and 90 people were infected by anthrax in a remote part of Siberia, where a heat wave had thawed permafrost, exposing a corpse of a reindeer that died 75 years earlier. So that's kind of a dramatic example, but we are expecting with the thawing of the permafrost, there will be other corpses that they're already gearing up for it, other corpses that died from anthrax that will be exposed. And then the last one I think I have as an example, a team of researchers collected samples from the Earth's oldest glacial ice from 50 meters below the surface in Tibet and uncovered 28 ancient viruses previously unknown to scientists. And so we just don't know what that effect is going to be. So, all right, so let's talk a little bit more. Reasons for emerging infectious diseases. You have changes in host ecology. You have, which means that, the host behaves differently. That happens a lot when you have decimated forests from deforestation. You have spillover effects where you're exposed to new types of diseases because new types of species are thrown together. And you have some diseases that are arising with no particular human involvement at all, but they still seem to be having effects. So we'll talk a little bit about this. Why do we have so many effects that are probably coming up now? Well, look at how much of if you were to ask, the total weight of land animals now is about 10 times what it was in the pre-human world. So if you look at this, we have 1.5 billion chickens. Let's just look at a couple of these. There's like a 500 million turkeys, 22 billion chickens now, and 1.5 billion cattle. So that means that for every person on the planet, there's about 3 chickens. So that's a significant change in the biomass. Where we were, just 250 years ago, it wouldn't have looked like this. And so, obviously, with that kind of change in biomass and where the resources and the number of species on the planet, you're going to have some interesting experiments in disease. The most prevalent arbovirus is human dengue. The gentleman this is the research station in Peru, one of the research stations. The gentleman to the right of me, or your left, I guess, is one of the world's best photographers, wildlife photographers, but he had dengue. And so he spent 2.5 weeks on that particular tour in just trying to recover. And so you're seeing that this is the most prevalent arbovirus now, and dengue, like I said, it has reached the shores of the United States. And it's a pretty devastating, if you've never had dengue, it's a pretty devastating thing to go through. The fevers, the aches, as the virus invades your blood. It's a pretty serious disease to have, and it can be even more serious if you get it twice. There's a couple other things that is Nipah the next pandemic? If you think COVID was bad, Nipah has a 60%, 40 to 60% mortality rate among all age groups, and so it's one that we do worry about, and that CDC has on there. It's one of their surveillance, and so as soon as they see something like this, they are out there very quickly. So I did start off by saying that climate change has, a lot of the evidence is pointing that climate change is supporting more diseases in many ways. But there are some things that that kind of cloud the evidence. One of these is the chytrid fungus, which affects frogs. Most of us are familiar with the Batrachia chytrid dendrobatidis, which affects frogs. It's been causing a lot of frogs to disappear from the planet. Interestingly enough, there's not been much of a change in frog populations in Texas. And part of that may be because the chytrid fungus doesn't function as well or is not as infectious at higher temperatures. And so for the last 2 decades, as the temperatures have risen in Texas, we have seen that there is some evidence that the chytrid fungus isn't able to establish. It needs cooler temperatures at some part during the year. So that does cloud it a little bit when we're talking about the effects of climate change. The other thing that makes it really difficult when we're talking about disease and climate change is what are we really saying about emerging infectious diseases when we say change in host ecology, spillover effects, host, that really covers up a lot of different, I think it's going to give it to me. It covers up a lot of different things. So those could cover up things like new infectious diseases, new strains, new reservoirs, new symptoms, new vectors, new susceptible species. And so many times it's hard to tell cause and effect when you're talking about climate change and disease because so many things go into disease vectors and pandemics. Some other things, more human-related, humans in areas that weren't formerly in those areas, overpopulation, war, poverty don't help. Climate change is another one, varying disease densities, and so there's a lot that goes into it. So many times it's really difficult to see the case of how, or somebody will ask, well, is climate change causing all this to occur? And typically I say, well, the evidence is yes, but there are lots of caveats because there are so many things that go into disease spreads. Let me pass this one. All right, so one of the questions I want to end with, which has been more important in species population decline, extinction, habitat, or infectious disease? You don't have to answer, but. So most people would say habitat, right? It's an easy one, habitat decline. However, there's a lot of evidence that that diseases is acting far wider currently than habitat, because it's killing things in places that have never, really seen much human population or sparsely populated humans. You also look at a lot of the things like the African wild dog. Most of their populations have been decimated by canine distemper and rabies, which most of them probably spread from domestic animals that we had, but the effects are dramatic. As far as disease, and so we're seeing that there's only about 6,000 of those left, and that's 6,000 is not long. That's typically a species that won't last very long. But if we also look at some of the other things, you've got rinderpest, which killed 90% of the ungulates in Africa, northern Africa, which actually is what's driving a little bit of the poverty among a lot of the poverty in places like Chad and Ethiopia. But if you can see, the number of declines related to disease goes on and on. I won't go over all, on and on. And so one of the things that we talk about is that pathogen-driven population declines have been identified in all species, really. And research in more recent years indicates that such diseases limit the distribution and abundance of susceptible species, and that these factors are often grouped as habitat loss that primarily govern local or complete extinction. So we're having, this is all to go and say that if you look at what we talk about, you've heard the term HIPPO, which is supposed to, it's habitat loss, invasive species, population decline. It was one of the E.O. Wilson's acronyms that he used to use a lot. One of the things, if you look at it, it doesn't include anything about disease in there, and I think that's one of the short-sighted things that we're starting to find out now, is how important it is when we're talking about species loss. If you look at the IUCN, if you look at what they classify as the #1 causes of species decline and loss, once again, disease doesn't even appear. It's a very big conservation biologists have started to realize that. I'm sure if Yvonne was here, he would tell you it's a huge deal, and that we're starting to wake up to it, that disease is acting far wider than even the footprint of climate change. Now that may or may not last, but a lot of times when climate change induces something, the effects can be far wider than you would normally guess. I won't go on. So any questions? Oh, we got one up back there.
I just wanted to say, when you at the very beginning, when you talked about loss of life, the pandemic that we just experienced, COVID-19, has reduced the life expectancy in America. So,
How much do we currently know about avian flu spreading across a variety of species in North America? I mean, I'm reading that even sea lions are contracting the flu virus.
Well, this is a tough one. There's a whole other discipline called immunity in the wild, and what we find is that it's difficult to understand the impact, because many times when we go out into the field, we can sample for antibodies, and we're finding that there's a lot of wildlife that has antibodies to diseases that we didn't even know were there. So when you talk about, it's almost like a shadow. So avian flu is pretty widespread. It's decimating all of the island species almost. There's very few islands in the Pacific or the Atlantic that aren't being affected by some type of avian flu. And the deal with avian flu is it's so easy to, it changes so quickly, it's hard to tell which avian flu you're talking about. Does that answer your question, sort of?
What is a Christmas tree shrew?
I'd have to ask my mammologist there. I've never actually messed with one or had to raise one, but I know that they're a shrew that gets on some of these islands and they do a lot of damage.
You may have mentioned this and I missed it. I'm wondering if, maybe a stupid question, habitat loss is increasing the rates of infectious diseases, so they can't be really separated from each other.
It's really difficult to separate habitat loss. So I can tell you, so like in Peru and even in Costa Rica and Madagascar, the habitat, because humans move so quickly, like in Texas, let's say, we put roads in, right? And the roads will have effects that are far wider than just this thin strip. So what we're noticing is that habitat loss is having a far wider effect too, because what happens is you're bringing a lot of edge species together, and those edge effects are going far deeper into the forest, the undecimated forest or the uncut forest, than just the habitat loss. And so it's kind of hard to tell because there's nobody out there that's really monitoring for that stuff.
A quick question. Your first picture was that of a bat. Is there a relationship between the bat, climate change, development, and COVID-19?
That's a COVID-19 question. So my understanding is, and this is, let me try not to be too controversial, because you can see Peter Daszak was, he saw his name. Okay, so Peter Daszak is one of the, there's been a big, strong debate as to whether COVID was made in the lab or whether it was natural. At this point, it's almost impossible to tell, because, and I will tell you, I do a lot of biosafety with a lot of companies, and most of the time, unless you have a specific disease that has very specific symptoms, which most don't, you will never know if it came from a lab or not. And that's for most things that I have to work with, BSL level 3 and below. So that's one aspect of it. The other one is that COVID is unusual in that it's somewhat unusual, and we haven't found a exact match in nature. But that's not unusual either. So it took us, we still don't know specifically what causes Ebola or what's the reservoir for Ebola. Zika was an unusual one. We knew Zika from 1948, but we never knew the symptoms that it has. And so it's not easy to tell. So bats do carry a lot of coronaviruses, and we're used to seeing bats as various vectors of diseases, rabies and such. And so bats typically are one of the species that if you're going to work with bats, you need to be very, very careful because they do carry so many diseases that do spill over into our population. That's right.
Okay, I believe that concludes our last panel. Thank you so much. That was really, really useful. All right, so some of you have been with us since the very early morning. Thank you for being here. Before you leave, I want to thank our fantastic tech team from TLED, who's been in the control room back there, taking care of all the lights, the sound, the visuals, and they also have been recording the live event. And we will send you an email if you're registered. You'll get an email with the link once the live recording is available. It will also reside, the link will also reside on our website. Our website is austincc.edu/peace. I also want to say how grateful I am for my former colleague, Renee Renteria, who has retired from ECC, but he's back here volunteering his time and his photography talent all day long, taking photos. So those photos will be up too. And I want to ask you to please complete the survey, austincc.edu/peace survey. We'll also send you a link through, you've registered, so we've got you. We're gonna, we'll be sending you an email reminding you to do that. Even if you haven't been here for the whole day, whatever feedback you can give us will help inform what we do next. And last, I know that it's kind of weird to thank your own people, maybe, but Leila Taragi and Michelle Guillen, without those two people, none of this stuff would happen. They're amazing to work with, and I can't wait to celebrate with them soon. Thank you, everybody. And thank you for being here. Really, really appreciate you. Marc Shepard, was a pleasure working with you on this year. And we have the science department involved with us now. Thank you. Have a great weekend.